Hi everyone. The diagnosis that I chose and will be presenting is illness anxiety disorder. So first we can look at the DSM-5 criteria for diagnosis. And so criterion A is a preoccupation with having or acquiring a serious illness. B, somatic symptoms are not present, or if they are present, they're only mild in intensity. And this will be important later when we're looking at differential diagnosis, because if somatic symptoms are present, it'll be a different diagnosis. Criterion C is that there's a high level of anxiety about health, and that the individual is easily alarmed about personal health status. Criterion D is that the individual performs excessive health-related behaviors, for example, repeatedly checking his or her body for signs of illness. And as some of you may realize, that's kind of similar to OCD. So again, we'll talk about that later in differential diagnosis, how to kind of tell the difference between those two. And they also exhibit maladaptive avoidance. Again, that's pretty similar to like anxiety or something like that. And then criterion E is illness preoccupation has been present for at least 6 months, but the specific illness that is feared may change over that period of time. So they could start with like having a fear of cancer and then move to like a stroke or something like that. And that still counts as long as they have a fear of getting that illness for at least 6 months. And then criterion F is the illness-related preoccupation is not better explained by another mental disorder, such as somatic symptom disorder, which we'll talk about later, panic disorder, generalized anxiety disorder, body dysmorphic disorder, OCD or delusional disorder, and somatic type. And this diagnosis does have specifiers, which we can talk about more in specifics on the next slide. So for this one, like I said, there's 2 specifiers. So the first one is care-seeking type, and in this one, medical care, including physician visits or undergoing tests and procedures, is frequently used. So this group of people will visit physicians to request diagnostic testing or seek reassurance about a feared illness. So they want to go, they want to hear that they're okay, they want them to run all these tests. And then the other type, on the opposite end of the spectrum, is the care avoidant type, where medical care is rarely used. They will avoid physicians because they're worried about being diagnosed with their feared illness. So, I might have mentioned earlier, this is actually a new diagnosis to the DSM-5. In the DSM-4, there was a diagnosis of hypochondriasis, but critics said that this diagnosis was too narrow and was over-restrictive and arbitrary, so it was pretty hard to get that diagnosis. So in the DSM-5, they changed things a little bit, and that was replaced with 2 new diagnoses, which are somatic symptom disorder and illness anxiety disorder, which is the one that we're talking about. So somatic symptom disorder and IAD are similar in demographics, the onset, lifetime duration, number of episodes of health anxiety, cognitions and behaviors, and comorbid distress and general anxiety. So they're pretty similar, but SSD is associated with more severe health anxiety, more severe somatic symptoms and functional impairment, greater health service utilization, higher rates of panic disorder, more severe depression symptom severity, and higher rates of major depressive disorder and agoraphobia compared to those with IAD. So basically, the somatic symptom disorder is a more severe diagnosis compared to the IAD. And then we can look at differential diagnoses. I know I mentioned these a little bit a few slides back, but we can kind of go into more detail. So first, we need to make sure that we're ruling out other medical conditions, make sure that their fears aren't coming from something legitimately wrong with them. And then adjustment disorders, somatic symptom disorder, which is what we just talked about, so basically just the more severe, if they're having somatic symptoms, then we would need to look at that. Anxiety disorders, OCD, and that one can look similar at first if we're only looking at certain behaviors, like the repeatedly repeatedly needing assurance, or like the tic type behaviors. And then there's major depressive disorder, and there's also psychotic disorders that we'd have to rule out all of those. Comorbidity. So this is a new disorder, so exact comorbidities aren't known yet. But we can look at hypochondriasis, and that typically co-occurred with anxiety disorders, and in specific, that's generalized anxiety disorder, panic disorder, and OCD, and it also is comorbid with depressive disorders. And approximately 2/3 of individuals with illness anxiety disorder are likely to have at least one other comorbid major mental disorder. And individuals with illness anxiety disorder may have an elevated risk for somatic symptom disorder and personality disorders. And again, that's not specific, these statistics aren't specific to illness anxiety disorder because it's new, but hypochondriasis is close enough that we can kind of get an estimate. So then the next study I thought was really cool. So it was looking at fears, coping styles, and health behaviors. So because these people are presenting with a lot of fear of getting sick, usually with like a specific, but just in general, like they don't want to get sick, it might seem kind of intuitive that they would be more health conscious, maybe make some of those efforts. But interestingly, hypochondriasis was not associated with health promoting behaviors. This could be due to avoidance of illness-related stimuli. They may also believe that they have the terminal disease and they have no control, so there's no point in even trying to improve their health. And another study actually found that there was an increase in safety behavior, it was associated with an elevated degree of health anxiety. So instead of being more health conscious to not get those diseases, they actually do the opposite and tend to avoid anything that would like improve their health. And this can just be like similar to how those with panic disorder may exercise less. So like we know, people with panic disorder don't want to exercise and increase their heart rate, increase their breathing, anything that will stress them out and maybe cause that panic attack. Well, this is similar in that they're avoiding those stimuli, so they don't want to think about eating healthy, they don't want to think about exercising to improve their health because that makes them conscious of it, and then they're more worried. And so those with health anxiety and panic disorder were also more afraid of dying than control in depressed patients, which I thought was really interesting. Prevalence, again, a new disorder, so there's not a whole lot of statistics yet on prevalence, but we can look at hypochondriasis. And so with that one, there's a 1 to 2 year prevalence of health anxiety and or disease conviction ranges from 1.3% to 10%, and 6 month to 1 year prevalence rates are between 3 and 8%. Impairment. So this one has like quite a bit of impairment, and the illness concerns assume a prominent place in individuals' lives, affecting daily activities, and may even result in invalidism. So, like mentioned previously, those with health anxiety may avoid cues associated with health, like doctor's visits, which we know like physicals are important to stay on top of any like blood sugar, weight, anything like that. They'll avoid exercise. Again, like I mentioned earlier, they just don't want to think about it. Eating healthy, and all these things will add up to long term. Even if they didn't have issues before, it will negatively impact their health and could lead to them actually developing the illnesses that they're worried about. And then impact on others. So the incessant worrying they have about getting sick can become frustrating for others. Safety behaviors may include asking the people around them for reassurance, kind of like we saw with OCD. In a lot of these cases, they'll constantly ask the people around them, like, is that safe? Are there germs on that? Do you think I'll get sick from that? Does this like look weird to you if they have like anything on their skin? And so that can kind of just get annoying for the people around them. And another example is they may also avoid others in fear. Like if any of their family members seem sick, they'll completely avoid them, not be there for them. Like in the hospital, they're not going to visit them. They may also avoid like social gatherings in fear of the germs and getting sick. Course without treatment. So the anxiety leads to maladaptive avoidance of situations or activities the individual's fear might jeopardize their health. So that's kind of what I was talking about earlier, like avoiding family functions, avoiding going to the grocery store, avoiding going to the gym, things like that. And the health anxiety often interferes with interpersonal relationship, disrupts family life, and damages occupational performance. It's hard to work when they're so concerned about getting sick, and some may even quit because they don't want to go to like the office setting. Etiology. So patients with hypochondriasis, again, we don't have data for the illness anxiety disorders, so we're looking at this one in the DSM-4. It did show a large number of serious illness as family members and more serious illness of their own to maybe be related to why some people will develop the illness anxiety disorder or hypochondriasis. And there has been speculation that a history of childhood maltreatment is related to hypochondriasis, but interestingly, the Baylor study found that all those things listed were highly associated with depression, but not hypochondriasis. So that one was ruled out. But there's not really, we don't know for sure yet what causes the illness anxiety disorder. And then psychopharmacology. So there's a few SSRIs that have shown to be effective, and those are listed there. And in patients treated with SSRIs, about 60% no longer met criteria for hypochondriasis at an average of about 8.6 years later. So we can see that that's pretty effective. However, we can look at cognitive behavioral therapy and some benefits of using this over medication, as it's more cost effective. You can avoid the medication side effects. And Scarella found that patients actually preferred the CBT over medications. And so CBT for this diagnosis will focus on the misinterpretation of bodily symptoms, anything from like a runny nose, their like breathing issues, sore throat, anything like that. Identification of maladaptive behavioral and cognitive patterns, some of the avoidance that we talked about earlier, and alternative explanatory models for symptoms and psychological distress. And meta-analysis has supported the efficacy of CBT with large effect size, and somatic symptoms may be a modifier of CBT efficacy. So they ran a study with people that had chronic back pain and people that didn't, and the people with chronic back pain didn't show as much improvement as those who didn't. So that could be a modifier for how effective we see CBT end up being. And in the Weck et al. Study, 75 participants who had a diagnosis of hypochondriasis and were previously treated with ET or CT were contacted 3 years after treatment, and 72% of those participants no longer fulfilled the diagnosis requirements. So this shows that CBT is effective long term. And then we can talk about exposure therapy. So CBT are both found to be highly effective approaches to treatment of illness anxiety. Depressive symptoms were reduced significantly by ET and CT, but anxiety symptoms were reduced significantly in the ET condition, so the exposure therapy, which makes sense knowing what we know about exposure therapy. And in the Weck et al. 2014 study, 84 participants were assigned to a CT, ET, or control group, and the results indicated that CBT and ET are highly effective ways of treating illness anxiety. So basically, CBT and ET are both effective treatment options that should work long term too. And then here's my references if anyone wants to look into those. And that's all I have. Thank you.